Okay, we are now live on Facebook. I want to thank you for joining us for It's the Holidays. Why can't I stay positive? I'm Erica Narducci. I'm a licensed social worker and the program director here at Cancer Support Community Delaware. Sorry, there we go. So I want to encourage you to just get a pen, a piece of paper, open up a document on your computer, somewhere where you can jot down some notes, because we are going to take a couple pauses and I am going to ask you to just do some reflective thinking about things in your life and jot them down to come back to later to maybe think a little more about. So now's a good time to grab paper and pen. And just a quick overview of what we're going to talk about in our short time together today. Of course, staying positive, and what does that mean? And what might affect how we feel positive, things like dealing with depression, dealing with grief in our life. And then we're going to talk about resilience and what that is, and how that's really what we want to strive for instead of just being positive. And then we are going to do a little exercise practicing gratitude, and we'll talk about what that means as well when we get to the end. So I'm sorry, my slide is not going. There we go. So staying positive, what does that mean? Do you know someone who seems always as positive despite the circumstances? Maybe they sing Christmas carols all the time, almost to the point where it's annoying. So while having a positive outlook and a positive attitude is important, and we know people like that, and sometimes we even want to be around people like that because their attitude can be contagious, and it can help us through treatment. However, feeling like we always have to be positive, especially as we're going through the holiday time when everyone expects you to be happy and jolly, it can really be a burden. So my favorite holiday movie is Christmas Vacation with Chevy Chase. He plays the infamous Clark Griswold. Clark is the epitome of positivity through the holidays, and chaos grows as in his home as each relative comes, and he just keeps the smile on his face the whole time. He is determined to make it the happiest Christmas ever for his family. And then to top it all off, he's having some financial concerns. He's waiting for his bonus check from work to arrive. And when the delivery man comes and finds out it's not a check with money, it's actually only a membership to the Jelly of the Month Club, it leads to what my family calls the best scene of the whole movie, where Clark has just a complete breakdown. And he has a tirade of very colorful words during his little fit. So just putting on a happy face kind of caught up with him. Things do end up all good at the end of the movie. Like any good movie, it does have a happy ending. But just putting on a happy face and not being in touch with where we are with our mental health can catch up with us. So you heard me mention that positive thinking can be a burden for us. And so what is the burden? So first of all, it could be the inability to acknowledge that cancer or whatever the situation is difficult and it's frightening. So that can really feel like a burden. The insistence that you just put on a happy face no matter what's going on, that can really feel pretty like a heavy burden. You might feel guilty because you're unable to keep that positive attitude. You should never feel guilty just because you don't feel positive. Also, we might have a belief that a wide range of emotions is unacceptable. But really, as humans, we are created with the ability to feel and experience and express so many different emotions, a very wide range. And feeling unable to express that in our life and what we truly feel, it can really be stressful and it can be a burden. So we're going to take our first little pause to reflect a little bit. So I want you to think about, maybe if some of the things I already mentioned resonated with you and your experience with cancer, or maybe some other journey you've gone through recently. Do you feel the pressure to think happy or put a smile on your face or find a silver lining? And And if you do, I just want you to kind of jot those down and think about those and how they might have been a burden to you. And I'm just going to, while we pause for a minute, I'm just going to play some light music in the background, just give you a couple moments. Okay, well, hopefully you had a few thoughts, were able to jot a few things down, and I really encourage you to come back to them and think about them later. And maybe those are some things you might want to think more deeply through. So we're going to move on to think about some things that you might be feeling emotionally that are contributing to feeling like the holidays or your cancer journey are a struggle or a burden. So first, we're going to look at a little bit at depression and how that can, how that relates to our cancer journey and staying positive. So first of all, let's talk about distress. So distress is like when you say, oh, I feel so stressed. Like I was saying that yesterday because I didn't have all my gifts wrapped yet. I don't know how I was going to cook all the food I need to cook for the holiday, get everything wrapped, make sure the last couple of gifts come in the mail, whatever else I had to do. I was feeling stressed. So that's distress. It's a mix of anxiety, maybe some depressive symptoms. You might feel sleeplessness, a lack of appetite. You might have trouble concentrating, maybe even difficulty carrying on with regular activities. And although some distress is normal, I mentioned how, I was struggling a little with the holidays stress, that's normal. But a third of cancer patients experience more significant distress. It's not unusual. So while distress doesn't affect the cancer itself, it's not going to make your tumor grow any faster or slower, but it does affect how a patient can cope with cancer and their maybe also their ability to follow the treatment recommendations that they're given. Distress is not depression, but we do treat it pretty much the same. And that's why we're going to talk about it a little bit now. Some predictable stress points that you might have through a journey, other than maybe facing the holidays and having to deal with certain relatives or things going on right now. Other ones through a cancer journey are the time of diagnosis, maybe the time when you're making a treatment decision. Something we call scan anxiety, when you're getting ready for some tests or scans and waiting for the test and then waiting for the results, right? Those can all be pretty predictable points along our journey that are going to be stressful. But we often ignore this kind of stress, but we shouldn't, and we can address it. And we are going to get to some ways that we can kind of help deal with this in our life. But first, let's talk a little bit about what is depression. So everyone feels depressed and down sometimes. And when cancer is a part of your life, it's very normal to experience new kinds of sadness, fatigue, and grief. But up to maybe a quarter of people dealing with cancer actually experience clinically significant symptoms of a major depressive disorder. We commonly just call it depression, but the diagnosis is actually called a major depressive disorder. So on the slide here, you see what the symptoms are of depression as defined by the Diagnostic and Statistical Manual of Mental Illness, or the DSM, which mental health and medical professionals use to diagnose this. Only a licensed mental health or medical professional can diagnose depression. So if you feel symptoms like the ones we're going to talk about in just a minute, it's important you get connected with someone who can help you. You could start by talking to your oncologist, maybe your PCP, your oncology social worker, the nurse navigator, or someone else on your team about your concerns. So let's talk about what it really feels like, what the symptoms are, so you can kind of see the difference between this and just distress or stress in your life. So there are mood-related symptoms that depression has, and those can be feeling down, sad, hopeless, irritable, numbness, maybe even feeling worthless. There's also physical symptoms that come along with depression. The big ones are, well, all of these are big, but insomnia, that's when you can't get to sleep, or you wake up in the middle of the night and then you can't get back to sleep. Hyperinsomnia is where we might be sleeping too much, and even though we've slept a lot, we're still tired. There might be fatigue, appetite loss, and even maybe a loss of interest in sex. There can also be behavioral symptoms that go along with it. You have lost interest in activities that you used to enjoy. You might cry more frequently than before, and maybe just all of a sudden find yourself thinking, why am I crying at this? I'm sad, but the tears just came automatically. You might feel you're withdrawing from friends and family, and this might be something you recognize because it's the holidays and a time when you normally would be drawn closer to them. Or you might have a loss of motivation just to do daily activities, which can really feel like a burden and difficult. So some cognitive symptoms that might be going on. You could have some memory problems or trouble focusing, difficulty making decisions, and maybe some negative thoughts. And all of those can kind of feel like symptoms of some of our treatment. So it's important to kind of, again, have a conversation with your health team. Is this a side effect of my treatment, or is this something more severe that we need to look into? We know that this is common. Up to 25% of cancer patients have been known to experience depression like this, and that's up to three times greater than the regular population. It affects men and women equally. It can affect our quality of life. And as I mentioned before, with being distressed, it can lead to maybe a decrease in how you're sticking with your cancer treatment. So what else do we know? We know that distress and depression are treatable. That's the good news. So there are many therapies out there, kinds of therapies. I'm not going to go through all of them that are listed here, but they are well known in being very helpful in treating stress and depression and anxiety with people. Another one on the list there is exercise. That's a great way to really combat stress and depression. And that's something easy we can do. We don't have to make an appointment to do it. We can just get outside and take a walk if we want to. Also, mindfulness interventions we know are very helpful in our toolkit of helping to treat distress and depression in our life. And we're going to talk some more later about different mindfulness interventions that we know are useful. We can also use medications to treat depression. A combination of therapy and medications are often the most effective for people. It's very normal to seek treatment, including medications for your mental health during a cancer journey, even if you're a caregiver, or if there's other periods of distress going on. So maybe at the beginning of your cancer journey, you were like, this is okay. I think I can handle this. I don't need additional help. But it's possible that now things have changed for you. You add COVID to that. You add maybe a stressful holiday time to that. Maybe other life events have happened. Maybe your cancer journey has taken a different turn. So it's very normal to seek help, even if you're already away into your journey. Again, talk to your healthcare team about how you're feeling and work with them to make a plan of how you're going to proceed. The first step could be something as simple as adding some exercise into your daily life, even if it's just a walk around the block where you live. And then maybe talk about how therapy might be a good addition to what your treatment plan is. And it could be group, it could be individual, it could be both. And maybe medications are something you want to try as well. Getting help, whether it's from therapy or medication, it doesn't have to be forever. This is a season of life where you're going through a difficult time, and the next season may be different, and you may not need it past that. So before I move on to the next topic, I just want to stress again how important it is to talk to your healthcare team about your mental health. And if you're feeling very dark or very down, maybe even suicidal, don't wait to talk to them. Talk to a loved one, talk to a friend. If you need to, call a suicide hotline or get yourself to the emergency room. Don't wait and just address it immediately. And I want to stress how I mentioned before that the side effects that we feel from medication and treatment can sometimes be the same as depressive symptoms. So talk to your healthcare team and advocate for yourself that you feel like this is more than just normal treatment side effects. So we're going to move into now talking a little bit about grief and how that could kind of relate to not really feeling positive and struggling through our journey. So I have a quote here that says, we shake with joy, we shake with grief. What a time they have, these two housed as they are in the same body. And that reminds me of a comment I made earlier in the presentation, just talking about how as humans, we are created to feel and experience such a wide range of emotions. We feel sadness, but we also feel happy and joyful. And because we can feel joy, we feel grief. So there are many different kinds of grief. And I'm going to go through the list here and just talk about the different ones and maybe think in your mind if any of these resonate with you. So the first one is living loss. This represents how we may experience chronic or ongoing sorrow. This is the space between what is and what should have been. So for you, it may capture like how you thought you were going to spend your life right now, but it compared to how you actually in reality are spending your life dealing with cancer side effects. Another form of grief can be described as ambiguous loss. So this type of grief involves a sense of loss that may be kind of unclear, maybe it defies resolution. We feel loss, but we don't exactly know what we have lost, and it kind of makes it complicated to process. Cancer can also result in what has been termed loss of the assumptive world. That sounds like a big word, but what it means is we typically develop a sense of the world and we develop some assumptions or beliefs that help us feel in control. It gives us security and stability. It helps us make sense of our experiences. For example, we feel that if we work hard enough and we're a good person, we do the right thing, we're going to have a good life. And this forms our core beliefs about ourselves and about what we expect life, how we expect life is going to happen. But then suddenly when illness comes or a struggle, these beliefs can really be challenged, and that can be very disorienting. We may feel stuck trying to make sense of why are we having to go through this difficult thing? It doesn't fit with how we thought the world was going to work for us. Another type of grief is called disenfranchised grief, another big word. But this just means simply that when grief is invalidated, minimized, or maybe not publicly acknowledged, we feel a sense of loss, that our grief is not recognized by the people around us. Someone might say, just be happy you're alive, rather than expressing, understanding why you're sad because of what your cancer journey has taken from you. And this could come from, a loved one, maybe a friend, possibly even someone that is on your healthcare team. Losing a loved one is one of the most distressing and unfortunately common experiences that people face. Most people experiencing normal grief and bereavement will have a period of sorrow, they'll feel numb, maybe even have some guilt and anger, but gradually the feelings ease and it's possible to accept the loss and move forward. But for others, those feelings of loss are just debilitating and they don't improve over time. This is what we call complicated grief. Painful emotions are very long lasting and they're severe. And you may have trouble recovering from the loss and kind of resuming normal life because of it. Complicated grief is almost like, excuse me, an ongoing heightened state of mourning, and it keeps you from healing. And then the last one on our list is anticipatory grief. If you have a loved one with an advanced cancer, you may already be preparing yourself for their end of life. And as your loved one's illness progresses, you may feel like you've already maybe lost them as a person. And if this sounds familiar to you, that's what you're experiencing, anticipatory grief. And some common symptoms could be depression, anxiety, and maybe even increased irritability. So we've reached another point in the presentation where we're going to take some time to reflect. Again, that was a lot of information about grief. And maybe one of those, maybe more than one of those resonated with you. So I'm going to, in a moment, I'm going to go back to the other slide and hopefully bring our list up again. And I want you to just, again, jot down which one of those maybe resonated with you. It can be one or a couple of them. And maybe also jot down what you're grieving. And then maybe, and how can you honor or acknowledge that grief as part of your journey? So again, I'll play a little music. I will bring that list back up for us again. And just allow you to have a little time of reflection. Okay. So again, like before, I hope you will take some time later to maybe come back to your list and think some more about the things you jotted down. We're going to move on now to talking about resiliency and cancer. So what is resiliency? So resiliency is the active process of facing adversity related to a cancer or really any experience. Resiliency is the ability to restore your emotional and physical functioning while confronted with stressful life events. We all like to be able to function well, even when we're in a stressful situation, right? Resiliency, and this is the good news, it's not something you have or don't have. It actually involves behaviors, thoughts, and actions that can be learned and developed in anyone. So it's an active process, and it's something that we can learn and develop in our life. So cultivating resiliency through mindfulness. Mindfulness is one of the best tools we have to develop resiliency in ourselves. And it is a skill that can be learned. Mindfulness is helpful for a wide range of physical and psychological outcomes, including anxiety, depression, stress, fear of reoccurrence, even fatigue, chronic pain, difficulty sleeping, immune function, and surviving the holidays with your family. It has also been related to increases in the perception of our social support, optimism, and our overall quality of life. What I love is that it's a practice. It's something we learn through practice. It's not something that's just a perfection. Here at Cancer Support Community Delaware, we offer a lot of what we call mind-body stress reduction programs. These are all mindfulness classes that develop resiliency in you. And that includes yoga classes, Tai Chi, poetry, some art classes, of course, meditation and sound meditation. So mindfulness is not just meditation, it's all different kinds of things. And there are many things out there, meditation apps that you can use. Some of them do guided meditation, some of them are just quietness, maybe just listening to music. There's lots of podcasts you can listen to that give suggestions about building mindfulness. There's a lot of different ways. So, how can I? You might be thinking, oh, that sounds overwhelming. How do I build a mindfulness practice? And how can I add this tool to my toolbox? Well, here's three simple ways you can, and I would say not add it to your life, but incorporate it into things you already do. So one thing you can do every day is just look for the good. Look for one good thing. I'm not talking about positive thinking. This kind of allows for the emotions of thinking and feeling. It's about being grateful. And we're going to do a little activity next, a little reflection that is a gratitude exercise where we look for the good. Another thing we can do is just spend 10 mindful minutes. I would say even if you spend 2 mindful minutes, it's 2 more minutes than you did the day before. So being mindful doesn't have to be, just completely shutting down our brain, doing, quiet humming or whatever it is. It can be just anything that helps us kind of pause what's going on in our mind and just take a moment of quietness. Maybe it's when you take a walk and you just enjoy nature and engage your senses. You think about how the earth feels under your feet, what the temperature feels like, what you see, what you smell. Maybe there's even a taste in your mouth as you're walking. My favorite mindful minutes are in the morning. I absolutely love my first cup of coffee of the day. And I like to sit with my coffee. Often the dog will curl up on my lap. He's very soft and warm. So I try to use that time to not start thinking about the day yet, just to really enjoy the taste of the coffee, the smell of the coffee, and just feeling the warmth and the affection of the dog sitting on my lap. So those are a few just examples of how mindfulness is just incorporated in our daily day. It's really just taking a pause to be mindful. And then the third daily action that's suggested here is just doing an act of kindness for someone else. It could be as simple as just sending a text saying, hey, thanks for being a good friend, or bringing some cookies to the neighbor next door. Whatever it is, it's something that puts our focus on someone else instead of ourselves and what's going on. And that can really be, that just small action can be very healing and beneficial for us, as well as the person that you're doing something kind for. So we're going to have our last little time of reflection here. And as promised, this is going to be just kind of looking at gratitude and how using that as a mindfulness practice can be really helpful. And I'll share before we do this that this is a practice I do in my life. And to me, I found it the most beneficial thing to help me through, especially stressful times. I went on Amazon and I just put in the search grateful or gratitude journal, and many of them will come up. I bought one that gives little things I fill in every day across a week. So after a week, I've filled a spread of a page. You can just write it on a piece of paper. It can be in your mind. It can be on a plain journal. You can go on Google and just Google Images and type in mindfulness worksheets, and many, many will come up. So there's lots of different ways to find just some neat ways to think about gratitude and to get your mind thinking about what you're grateful for in your life. Again, this helps us see the good and focus on the positives. Instead of forcing ourselves to be positive, it's helping us find and see the positives. So in our last little time of reflection here, this is our gratitude exercise for today. I'm going to ask you to write 3 things you can look forward to, 2 people you can count on, and 1 thing that's going well for you in your life right now. And I'll just again play a little bit of music and give you a few moments to jot these things down. Okay, well, hopefully those things came to mind very easily for you. And as we wrap up, you have, a list of things you're very grateful, things and people. I encourage you to do this type of activity, or maybe even use the same one, and do it regularly to build a mindfulness practice, which is going to build resiliency, which is one of the best tools we can have to lower our distress and depression in our life. So just a few key takeaways before we close it out here. Remember that distress and depression, they are treatable. Resilience can be learned and it can be strengthened. And we did a little activity to begin strengthening it just now. Positive thinking isn't our goal. Building that resilience in us is really the goal. We need to acknowledge that grief matters, and thinking about the grief in our life and thinking through the losses we've had is important. And you don't have to do this alone. Many times I mention, just plugging in with your healthcare team, finding those that can help you through this. So through the holidays, I really hope you feel like Charlie Brown in this picture here. Charlie Brown Christmas is my other favorite Christmas special. Here he's smiling. It's the end of the show, if you're familiar with it. He's smiling because of the gratitude he feels for his friends and family. They have showed love for him and his little tree. And I hope through the holidays, that's how you feel as well. Okay, so